Question 1. A 64-year-old man presents with a non-healing ulcer on the lateral border of his anterior tongue. Biopsy confirms squamous cell carcinoma. Which of the following lymph node groups is most likely to be involved first in metastatic spread? A. Deep cervical, B. Preauricular, C. Submental, D. Submandibular E. Supraclavicular. Correct answer, D. Submandibular. The submandibular lymph nodes drain the oral cavity, including the anterior tongue, especially lateral parts, and are often the first to receive metastasis from oral squamous cell carcinoma. Why not the others? A. Deep cervical, downstream nodes, later involvement. B. Preauricular, drains eyelids and lateral face. C. Submental, drains tip of tongue, floor of mouth, lower lip center. E. Supraclavicular, drains thoracic or abdominal cancers, not oral cavity. Question 2. A 22-year-old man presents with a swollen lymph node beneath the chin after biting his lip. Which lymph node group is responsible for drainage of the central lower lip and tip of the tongue? A. Parotid, B. Deep cervical, C. Submental, D. Submandibular, E. Retropharyngeal. Correct answer, C. Submental. The submental nodes drain the central lower lip, floor of the mouth, and tip of the tongue. Why not the others? A. Parotid, drains scalp, eyelids. B. Deep cervical, deeper drainage, downstream. D. Submandibular, drains lateral lower lip and body of the tongue. E. Retropharyngeal, drains pharynx and nasal cavity. Question 3. A 55-year-old woman is diagnosed with oral cavity carcinoma involving the floor of the mouth and anterior tongue. Which of the following lymph node groups is most likely to be palpably enlarged due to metastasis? A. Occipital, B. Submandibular, C. Axillary, D. Inguinal, E. Mesenteric. Correct answer, B. Submandibular. Submandibular lymph nodes receive lymph from the oral cavity, including the anterior tongue and floor of the mouth, making them a common site of metastasis for oral cancers. Why not the others? A. Occipital, drains scalp and posterior head. C. Axillary, drains upper limb and breast. D. Inguinal, drains lower limb external genitalia. E. Mesenteric, drains intestines. Would you like a